How are you today, Zach?
Well, I'm doing good.
Yeah? So have you been feeling pretty good since I last saw you? Yeah? Has your tummy been hurting at all?
Inflammatory bowel disease is comprised of two related conditions, Crohn's disease and ulcerative colitis. Both conditions result in chronic intestinal inflammation and ulceration, leading to a variety of symptoms in children and young adults. The cause is unknown and there is no cure for this condition. Back in 2007, UNC was one of the founding members of the ImproveCareNow National Pediatric Inflammatory Bowel Diseases Network.
Clearly the most inflamed segment.
The existing model of care really focuses much more on being reactive in nature and treating flares or exacerbations when they occur. What we're trying to do is to work collaboratively with centers across the United States to redesign and restructure the process of care delivery to be much more proactive in nature, aiming to prevent complications rather than react or respond to complications when they occur. Over the last 6 years, the network has grown to over 57 centers in the United States and 1 center in London. Thus far, about 450 practicing pediatric gastroenterologists participate in the network, and the network reaches a total of 17,000 children nationwide. At UNC, our Pediatric Inflammatory Bowel Diseases program takes a multidisciplinary approach. Our care team is comprised of pediatric gastroenterologists with expertise in treating these conditions, but we also have a number of other providers on our team. We have advanced nurse practitioners, a clinical nurse specialist, and several dietitians. And we work collaboratively with other specialties throughout the hospital as well. Our team at UNC doesn't operate alone, but we have this network of teams from other centers who come together at regular intervals, either in the setting of in-person learning sessions or on monthly conference calls and webinars. We typically share ideas about best practices and benchmark our performance against one another. The network approach is not only a network of clinicians, but it's also a network of patients and their families and a network of researchers as well. Data about treatments and patient outcomes are collected at each and every patient encounter. Every clinical encounter is an opportunity for learning. At the end of the day, the benefit to patients is that they know that they are receiving state-of-the-art care and care that's meticulously thought about not only by our team at UNC, but by teams from across the nation.
Sometimes I have to go to the doctor's office and skip school some days. The skipping school part I'm pretty fond about, but...
And we've been coming to the doctor here. Do you like coming to the doctor here at UNC?
Yeah, they're great doctors. They're good with kids.
Yeah, and I think we've had a really good experience here.
They're also good with adults.
Yes, they are good with adults, and that's been really wonderful here. And I think the thing that really led us to try to seek care here at UNC was, one, it was a notable center. So it's an IBD center. This is what they do, inflammatory bowel disease, and they do it with kids, and that was really important for us. And I think another really big factor for us was that it was part of a large network. But now he has much more energy now that he's feeling better.
We're beginning to see that a lot of this work and effort is really paying off over the last several years across the network, and certainly here at UNC we've seen that the remission rates in our patient population have improved dramatically from about 60% in 2007 to now we're at well over 80%, which is quite remarkable, particularly in a time period where there have been no new medications that have come to market. So what we're doing is we're learning how to better apply and better use the technologies that we already have in place.
And I've met a lot of parents, and you've met some kids, and that's because we've been part of this network, and that's what the network is. So I think it's really been perfect for us.
I hope that they find a cure for this disease, but for now we can just relax and sit back.